Today, I'm going to present to you about the policy impacts evaluation on other groups Semarang Local Regulation Number 3, year 2013, by Dyah Hariani from Faculty of Social Science and Political Science, Diponegoro University. 47.14% of the population of Semarang City has a living pattern as a smoker. Implementation of Semarang Local Regulation Number 3, year 2013 about the area without smoking run into several obstacles. Those are: 1. Lack of compliance awareness or individual disciplines. 2. The limited operational funds. 3. The installation constraints of the board. 4. The lack of intensive counseling related to the non-smoking area in the Semarang city. And the last one, the absence of a special supervision team who supervising the implementation of this policy in the field. Based on that explanatory, the researcher chooses Manyaran Public Health Center, which is the pilot public health center of non-smoking area regulation, as a locus of this research, and the researcher will be focused on the impact of non-smoking area policy for other group in Manyaran Public Health Center. The literature's reviews used in this research are: public administration that conceive public policy and generate the policy evaluation. The evaluation of the policy in terms of impact can be known by some of his approach by Leo Augustin. There are dimension of main subject, dimension of two other situation and groups, time dimension, and cost dimension. According to Dyah, the impact in public policy evaluation, there are some indicators or dimensions that need to be considered. The first one is impact of a situation or group of targets. And then impact of policy on other situations or groups. The third one is the impact of policy on current conditions and future conditions. And then direct cost of a policy. And the last one is indirect benefits. After understanding the literature reviews, the researcher focused the policy evaluation especially on other groups of policy. According to Dyah, the other group of policy can be understood as a policy externally evaluated. For its case, qualitative method was essential. The data were collected through interviews, observation, and documentation methods. The informants in the study was chosen through purposive sampling technique. The data analysis used in this research is data reduction, data presentation, and withdrawal conclusion. Therefore, for the data validation, the study used triangulation method. Results and discussion. In a non-smoking area, there are other groups of people who are not smoking, as well as people who are in neighborhood of Manyaran Health Center. The impact of policy to other groups in this study can be seen from several aspects. Aspect of support. The results are: the community seeks to rebuke if anyone violates the rules. The community of Manyaran Health Centers in MMK agreed to implement a non-smoking area. The community of Manyaran Health Centers in MMK also didn't provide cigarette in every citizen meeting. Aspect of social. The results are: the level of comfort environment for them who do not smoke increasing. People who do not smoke feel more comfortable after this policy is implemented. Some smokers in a society who are aware that cigarettes are something that is not good for themselves and others. Notwithstanding, in the provision of information about the danger of cigarettes and smoking prohibition conducted by the government is still as influential for people who do not smoke. Aspect of perspective. The results are non-smoking area policy bring in people who do not smoke safer and can warn others in order not to smoke. The result provide that people's perspective begin to change slightly about the smokers. Conclusions. Non-smoking area policy implementation in Manyaran Public Health Center regard to other groups is known having some policy impact. The analysis leads to the following conclusions. Aspect of support. Aspect of social. Aspect of perspective. The advice that given by the researchers based on this conclusion are: it should take more supportive socializations to develop the community more understanding and aware of the danger that caused by cigarettes. The government should be more serious on mentoring the implementation of non-smoking areas in public environment by monitoring it periodically. Conduct a healthy life campaign without cigarettes by holding a race in the community environment. Thank you for your listening. May all those we have shared be beneficial for all of us.